It's been revealed that 2 to 3 cups of coffee a day could lower the risks of heart disease and early death. A comprehensive study of almost 400,000 coffee drinkers over a decade found it should form part of a healthy diet. Dr. Tamara Hunter, this is music to coffee lovers' ears. We thought coffee was bad for us. What's changed?
Yeah, so many people consume coffee for the caffeine and the stimulating effects of that. But in fact, coffee beans, being a plant, actually contain a lot of antioxidants. In fact, they're the richest source of antioxidants in the human diet. And so due to this impressive amount of antioxidants, it has these presumed health benefits.
And what are they?
Well, as this large study that was done over 10 years has demonstrated, 2 to 3 cups of coffee per day is likely to improve cardiac health. There's also other studies that suggest it reduces the risks of type 2 diabetes, liver disease, and even Alzheimer's dementia.
On the flip side, Tamara, how much is too much?
Yeah, well, that's an interesting one, isn't it? So we take it for its stimulating effects, which induces cortisol and adrenaline, gives us that alertness and often makes us refreshed. But if we're having too much of that, it can induce anxiety, panic attacks, jitteriness, and even poor sleep.
So should people start drinking coffee if they don't already?
Look, I think health is multifactorial. You've got to look at exercise, diet, weight management, smoking. If you just were starting coffee drinking for the sake of health, but you don't really drink it regularly, I probably wouldn't recommend it. To those who do drink it, it's probably not doing you much harm, maybe doing you some good if in moderation.
There's much research around caffeine and hormonal changes such as menopause. What is the advice around that?
So perimenopause and menopause is a natural transition for every woman. The most common symptom are hot flashes, which can be quite debilitating. Evidence does suggest that although caffeine doesn't increase the hot flushes, by reducing caffeine and alcohol consumption can help women manage hot flushes with menopause.
What about fertility, Tamara? Can coffee affect couples trying to conceive?
Well, the short answer is caffeine doesn't induce infertility. The studies back in the 80s suggested maybe a small risk of harm, and so the recommendation is 1 to 2 moderately strong coffees per day. There is some more recent research. A large group of studies suggested that the more caffeine consumed, the higher the risk of miscarriage. It's not a perfect study. It certainly needs to be taken into consideration, but as with anything around fertility, conceiving, aside from alcohol and smoking, moderation is best.
Tamara, we have some questions from viewers. Fiona Robinson says, again, changes from good to bad to good again. When will they make up their mind? It is confusing, Tamara. What should we believe?
Look, I think health is, as I said, very multifactorial. There's lots of different aspects of health that we can look at, from heart health to gut health to fertility health. So it really depends on the parameters and outcomes that you're measuring as to what exactly you're looking at the health benefit for.
You've spoken a lot about moderation, and this one from Tommy Donis, who writes, I have 2 or 3 cups a day, but they have 4 shots in each. So, Tamara, what do you make of Tommy's coffee intake, and how many shots do we need to get the most health benefit?
Yeah, so most of the research is about the milligrams of caffeine. It's kind of like saying how big is a glass of wine. So the standard coffee is around about 100 to 200 milligrams per day, no more than about 300 milligrams per day, and that's the moderate amount of caffeine per day.
Dr. Tamara Hunter, enjoy your weekend and your coffee catch-up.
Thanks, Mon.
Thank you.